Okay, I think we'll get started because we appreciate all of you joining here and your time is precious. So thank you so much for joining us today. Wherever you're calling in from, this is the media campaign briefing on this media campaign that we led at Vital Strategies. You have the power to save lives. This campaign was designed to respond to what we've witnessed happening over the past, now coming for the past decade, and a real jump that happened beginning in 2020 of an increase in overdose deaths in Black communities across the United States. You'll hear more about this campaign from our esteemed panel here today, and I'm pleased to serve as the moderator for you all. So I hope that wherever you're calling in from, this campaign resonates for you. We welcome new cities to join the campaign. You'll hear more about that at the end of this briefing, and we'd love to make sure the word gets out. So without further ado, my name is Dahlia Heller, and I'm the Vice President of Overdose Prevention Initiatives at Vital Strategies. And it's been my pleasure to work on this campaign and partner with many of the people who you're going to hear from today in this briefing. As I stated, the intention of this campaign was to raise awareness about naloxone and promote naloxone access in Black communities in 7 cities across the United States. Vital Strategies works intensively in 7 states, so we selected one city from each state where we saw that Black communities have been hard hit by the overdose crisis. You'll hear more about the details of how we developed this campaign and how we partnered with city and community partners across those 7 cities from the panelists following me. But before we get further into information about the actual campaign and how it worked, I first want to pass the mic to my esteemed colleague, Tracy Gardner, who is the executive director at the National Black Harm Reduction Network. Tracy, please.
Thanks, Dahlia. So I'm really delighted to be here. It feels like we've come completely full circle, and it's been fantastic working with the Vital team and develop a real connection with all the folks who've been involved in the campaign in the respective cities, and to see other cities start to adopt this campaign because it makes so much sense. Um, I am especially appreciative that we were able to work with Vital Strategies from the ground up on this campaign and not be brought in as kind of a tokenized afterthought. And so every element of this campaign, Vital made sure that they called upon the resources of not just the network, but of all of the folks that you see here today who are doing the critical work in their communities. If I had $1 for every time I got a press call, media call, or just a general question about why is the overdose crisis so bad, or why there are so many overdose mortalities in Black communities around this country, and the way I generally explain it is everywhere, almost everywhere there's a Martin Luther King Jr. Boulevard, there's going to be a confluence of system failures, divestment that leave a community at risk for health emergencies. Dahlia and I met each other in the midst of a health emergency called HIV and AIDS that disproportionately impacted Black communities because this has been a generational impact. And so we're creating a new groove with this kind of campaign. And when you hear more about what amazing inroads that folks have been able to make, that this become a part of Black community health, and that the communities planning and implementation of this is what is absolutely critical. Like just having the tools, having the resources, which started the campaign in looking at the overdose numbers and seeing that the very communities that were highly impacted simply did not have access to the array of resources that we know are scientifically proven to reduce overdose. So it's about access, it's about understanding culture and history, and it's about engaging people who have the respect and the who are just there as community champions, bringing this message and know-how, and folks took to it like proverbial fish to water. So, again, just want to publicly thank Dahlia and the Vital team, but also being able to work with all of the folks involved. I would be remiss in not pointing out that this campaign became an opportunity for almost a Black woman call to power. Because when Black women are healthy, the whole community is healthy. And we have been able to work in that way, not leaving out our brothers, but when women sit at the table, Black women sit at the table, stuff is going to get done. And that is what we have been able to do. And you're going to hear from some of those, warriors later on. Thanks.
Thank you, Tracy, and appreciate you. And I'm so grateful we were able to work with you from the start in this campaign. You were indispensable, and your wisdom and guidance as we worked through the development. Before we continue, I want to mention two things that I was remiss in mentioning at the top of the call too. One is that this webinar is being recorded so that we can share it in the future as an opportunity for sharing about the campaign with others. Second is that, as you've seen also in the chat, if you have questions, we will have a Q&A session at the end. Please put your questions as they come to you anytime throughout this webinar in the Q&A box, and our team will be gathering them, and we'll make sure to respond to them when we get to the end of the reports. So without further ado, then, I would like to introduce Sharda Sekaran, who is a communications consultant and who we were so fortunate to have as the campaign advisor on this campaign. Sharda.
Thank you, Dahlia. Thank you, Tracy, and to everyone on the call. I'm just going to share a little bit of background on the research that helped to inform the campaign, because I think there's some important elements of it to point out that helped us to really shape it and make it as effective as it was. So, Dahlia, you're able to go into the slides there. You'll see first slide has Wanda Boone, you'll be hearing from, one of our campaign spokespeople. So just the role of research in the campaign, you'll be hearing about more, but I just want to emphasize that we knew from the start in building this campaign that we needed to be accountable to specific communities and long built local partnerships that Vital Strategies has formed in these 7 cities. And we needed a campaign that was relatable and authentic enough to feel credible and persuasive to these local partners, but yet it needed to be general enough to adapt to the different cities and scaled up for the future for all the cities who we hope will be joining the campaign, who've already started, and we hope that more cities will join. So it needs to be ready to be custom for who we have existing relationships with, and then ready to be adaptable for the future. And all of this led to some fundamental aspects of the campaign strategy that help make it a success. So the next slide, I'm just going to talk about the 3 phases of research quick on the campaign. So in this slide, it's 3 phases. We had first phase one of the research at the start of the process, where we're able to test content that has been created for past campaigns Vital Strategies has done. So we had those existing assets, and with our research partner, Zebra Strategies, we were able to test them in these different 7 cities among our target audience. Second, we had a phase 2 of research, where after the preliminary campaign creative assets were developed, so the specific early form of the assets for this campaign, we then tested again in those 7 cities to see how people responded to the campaign's preliminary messaging. And then last, in phase 3, which you'll be hearing about after me from Nandita, is a third phase of research, where after the completion of the paid media buy, we were able to measure the campaign's saturation and impact. So that we really focused on our key audiences throughout and anchored the campaign in community accountability. Next slide just does first two phases to just get into some more of the specific details. So the formative research phase one and the campaign messaging research phase two with the assets we developed, we had a combination of focus groups and interviews in those 7 cities with about 38 to 40 people. And all of the research participants are people who identify as Black and who live in predominantly Black communities in those target geographies. And then what we got from this research in the next slide, key takeaways from the research, we learned that it's important to have a combination of local and national data to include diverse representation in imagery and tone, to strike a balance in our tone between hopefulness and seriousness, to provide clear, actionable steps such as where to get naloxone and how to use it, and to combine personal stories with community level framing, featuring naloxone in a variety of settings and scenarios to boost people's confidence that it's something that's applicable in any situation, and to tap into its feelings of motivation for protection of family and community. And then just on the last slide, we knew from our formative research with Zebra Strategies that there were some core things that are barriers to get our message across about overdose death prevention in Black communities. And these are some of the things the campaign was specifically designed to address. So to avoid stigma and demonization, to address risks but not lean into fear, to center solutions and lead with empathy, and to really use the campaign to start a conversation about putting power in the hands of communities. So that's it for me on my piece, Dolly. I'll pass it back to you.
Thank you, Sharda, and for laying that out for us to share about how the campaign developed. So then, as Sharda mentioned, next we will hear about the research or the post-campaign impact survey that was conducted to learn more about how the campaign performed. And I'm pleased to introduce Nandita Murakutla, who is the Vice President of Global Policy, Behavioral Insights, and Evaluation at Vital Strategies. And take it away, Nandita, while I grab your slides.
Thank you, Dahlia, and good afternoon. I'm delighted to be here to share with you a preview of findings from our evaluation of the You Have the Power to Save Lives campaign. We will have a more detailed report available soon, but today I'll walk you through some of the key takeaways from what has been a robust and rigorous evaluation of this campaign. Next slide, please. As you've heard in the introduction and from the other speakers, opioid overdose deaths disproportionately affect Black communities. And while naloxone distribution and harm reduction services have expanded more broadly, Black communities continue to fall behind. What's really important to underscore here is that it's not just an issue of supply or availability of naloxone in communities. Rather, there is also a social dimension to this public health problem. Low awareness coupled with stigma and mistrust play an important part. And that's why the campaign was designed to build awareness and normalize naloxone use, increase empathy and reduce stigma, and empower individuals to take life-saving action. And so the goal of the evaluation was to assess whether or not the campaign achieved these objectives. Next slide, please. What I want to also underscore here about the evaluation methodology is that it was designed and conducted with rigor. We used gold standard evaluation methods and measures drawing from the social and behavioral sciences so that the evaluation itself offers a service. Not only can it robustly document the performance of this campaign, but our intent here was to systematically advance our knowledge of what works so that we can effectively support and see other implementation of these lessons scaled up in other communities to achieve wider social and behavior change around naloxone use. So in summary, I'll be brief about the methods, but also say the field work was carried out by a third-party company called Thinks Insights using gold standard research methods. All of the survey work was completed rapidly within a week, which means we don't have seasonal or time lag effects. We surveyed a large representative sample of 3,200 Black adults across the 7 US cities in which the campaign rolled out. We used validated science-based measures. So these are the indicators, the questions we used in the survey. They are drawn from the literature, and what that means is we're adding to a knowledge base, and they're good predictors of a campaign's performance. And importantly, we used advanced statistical analysis, particularly regression models, so that we could really isolate and test the effects of the campaign itself while controlling for all other potential confounders. Again, the full report will be available shortly, but the main headlines and takeaways are as follows. Next slide, please. According to our surveys, 37% or nearly 1.9 million people recalled the campaign. This is recall of the campaign, which is different from exposure to the campaign. There will be many more people who were exposed to the campaign. They may have seen it subconsciously, but it's 1.9 million who saw it, remembered it, and were able to say something about it. So that is an important measure of a campaign's reach. For a public health campaign to achieve this in just 3 months and in such a competitive media landscape really reflects the strength of the strategy that included a mix of digital, radio, outdoor, and community partnerships delivered through trusted local voices, all of which helped the campaign cut through and connect meaningfully with people. So this broad media and community credibility was really underlying what led to that 1.9 million that recalled the campaign. Next slide, please. But once you reach people, that's not enough by itself. What also matters is how the messages are received and how they motivate action. Here again, we saw strong evidence that confirmed the direction in which message testing had pointed us. The majority of people who recall the campaign said that the campaign was easy to understand, believable. Many also reported that the messages taught them something new, made them stop and think, and encouraged them to learn more about naloxone and health services. Again, these standardized behavioral indicators used extensively in the literature are highly predictive of whether communication will lead to real action. Next slide, please. And in fact, the results show us that the campaign did drive meaningful behavior change. In regression models, where we are testing for the campaign's unique effects, we found that the campaign was led to significantly more likelihood of people carrying naloxone. That's a 5.6 fold increase in likelihood of carrying naloxone, to know where to get it, and to feel confident using it. This was all of the empowerment and behavior change that the campaign was really intended to drive. Next slide, please. And so in my summary slide, I'll just underscore that this campaign demonstrates what's possible when health communication is designed with and not for communities, where awareness is increased, but along with it, confidence grows, motivation is triggered. That's when you see behavior change that leads to life-saving action. Looking ahead, we see certain further calls for action, deepening local adaptation, addressing misconceptions. This campaign has achieved a fair amount, more to be done, and a lot more that can be done. So misconceptions that can be tackled head on through expansion to more cities and sustained impact beyond this initial media window. So with that, I'll hand over to you, Dalia. Thank you.
And I was muted. Thank you, Nandita. That was fantastic. And it's really amazing to see those results from the survey. So exciting. And so then let's hear more about perspectives from the community on the campaign itself. And I'm so pleased to be joined today by two of our community partners for this campaign. It's my pleasure to introduce Anita Garrett, who is a community leader in Milwaukee, Wisconsin, who was featured in the campaign as one of the subjects and works with West Care there in Milwaukee and has some to share. Please, Anita, take it away.
Thank you so much, Daya. Hi, like she said, my name is Anita Garrett, and I'm going to start this off by why I got involved with Vital Strategy. Vital Strategy, would you have the power to save lives? I got involved because My son died of a drug overdose. And without the knowledge of the people that were there in the house, they all fled. And I felt if they would have been knowledgeable and had access to naloxone, my son would be here today, like many other mothers that have lost loved ones. And a lot of you on this call have lost loved ones due to the fact there's not enough knowledge. So, with that being said, I took my pain and I turned it into a purpose. And my purpose was to address drug overdose, bring awareness to my community that they have the power to save lives by using naloxone. And by doing this, I was featured on the radio station. I was featured in newspapers, and I was also going out to community pop-up events, telling my story. I feel people can deal and relate to you, a real live person, telling what happened to you and letting them know that it could happen to them also if they don't obtain the knowledge that they need to save a life. Like just having a naloxone and not being able to use the naloxone is not going to help you. So here at West Care, we set up where a person could come in and actually use naloxone on a person so that when they came into a situation that they just didn't have naloxone and didn't know how to use it. Because when you dying over overdose, every second counts. So you have to be educated and knowing how to use naloxone. So with that being said, my daughter was so proud of her mom speaking up. I can't bring my son back, but I could save another mother from going through the pain that I went through. So, with that being said, my daughter one day was driving down the street and she seen a car like weaving in and out, in and out, in and out. She knew the person was in distress, but she didn't know what distress that person was in. So while he's driving aside, all of a sudden he went to the curb, she said, and the car stopped. So then she proceeded and pulled over and got off the car to find out what was wrong. It was something that she could do to help. So when she got to the car with another passenger in the car, and a lady mentioned that he had drugs. So then my daughter knew right away to run back to her car. And this is so amazing. She ran back to her car and she got her naloxone and ran back to the car. By this time, other cars and people are pulling up to assist. And that was just, and she called me on the phone by the time the paramedics had came and took over. But it was just the fact that bringing awareness to our community that you have the power in your head to save that life is so rewarding that I can't even put it into words how it felt so good. And she felt so good and proud. She couldn't bring her brother back, but she saved another mother from going through what she went through. So I know I only got 5 more minutes, but I'm just saying I am grateful for Vital Strategy bringing this in to our community that you have the power to save lives, not only get carrying naloxone in your car, in your purse, wherever you go, because you never know when you're going to be in a situation where you need to use naloxone. Thank you so much, Dahlia.
Thank you, Anita, and thank you so much for all you do in Milwaukee and for sharing this story. And thank you to your daughter for carrying the work forward. Really, I mean, it's a remarkable story, and I know it has everything to do with your leadership, and your leadership shows up in this campaign. So thank you for that. And then to turn to another fantastic community partner who we were so pleased was able to join the campaign. I'm pleased to introduce Dr. Wanda Boone, who is the CEO of Together for Resilient Youth in Durham County, North Carolina. Wanda, please go ahead.
Thank you. I'm so glad to be here with you today and to talk about you have the power to save lives because it's so true. Even though Durham is not the largest county in North Carolina, and so it's important for me to say, first of all, that we know that. However, Durham is the only county in North Carolina that has more overdoses among Black people than any other ethnicity. And this is something that troubled me for quite some time. And so to have the opportunity to be a part of this campaign was just overwhelmingly exciting. The reason that I'm showing this circular pattern here is because TRI is a coalition, and we believe that holding young people totally responsible for, and you can fill in the blank, is like holding fish responsible for dying in a polluted stream. It's the adults that surround young people that will help young people to be better in the future. And we can go to the next slide. And so, because we were instrumental, I believe, in the COVID-19 process, we gained a lot of insight and knowledge in terms of what our community, our Black community, was experiencing. And it wasn't just the fear of um, COVID, it was also the trauma awareness, thinking about it, the stress that needed to be discussed and talked about. So we didn't just talk about COVID. We talked about stress, we talked about grief, we talked about support. And it's the same thing that we are doing with this campaign. The materials are phenomenal. They were accepted in a wonderful way among all of our stakeholder groups, which you saw around that tri-circle. And so let's go to the next slide. And so one of the things that we've done is in our training, along with talking about naloxone, we talk about opioids, the facts around them, demographics, trauma, grief, what census tracts look like, and harm reduction principles. And we've created specialized naloxone programs or guides for adults, students, college students, community organizations, court judges, faith communities, healthcare workers, parents and PTA members, pregnant women, the recovering community, school staff, seniors, and youth. Why? Because one conversation isn't enough, and people see themselves as a part of a stakeholder group. And so that when we can approach them in the way that they are influencers in, then they participate in a greater way. And these are not complicated guides. They're just specific to certain stakeholder groups. I'm really proud of our young people, ages 13 to 17, who have taken this by storm. We've used expired naloxone kits with balloons attached to them. We do that with adults also, to go through what it means, what to do, how you can be safe, how we have the policy in North Carolina where you won't get in trouble if you administer naloxone, and it's needed in public schools, which that has been supported by the superintendent of public schools, who says that he believes that every student in middle and high school should carry naloxone. And so they are expert, I will say, in administering naloxone or knowing how to do that. We've also developed an opioid misuse and overdose prevention community guide, a resilient recovery guide, and a Spanish version of working together with bilingual folks. Next slide. And in terms of engagement, we're not only talking about individual, we're talking about public housing, clinics, 200 businesses, over 200 businesses, including convenience stores, barbershops, grocery stores, anywhere and everywhere that our health ambassadors engage, we are there. Next slide. And so here we are I'm mentioning our Health Ambassador Program, where some of that training that I'm talking about opioids and all those things that relate to trauma and stress in the Black community is so important. Census tracts, we know exactly where we need to go, where overdoses are taking place. We also realize and have data on where, unfortunately, some peer support is not reaching certain Black communities because of several different reasons. And so we seek to fill those gaps with health ambassadors. So over 400 youth, and these are large numbers of youth in different areas and different circumstances, and over 280 college students have been engaged and become health ambassadors. And that does not leave out our adult health ambassadors and our senior citizen health ambassadors, because overdoses are seen in all in all areas in terms of age, and we don't want to leave anybody out. And in the past few months, we've had non-community events. Next slide. And here's a picture of our community event, because it's so important to us that this conversation around overdose and naloxone also includes the things that are needed in our community, such as access to food and fresh produce, access to services. And as I mentioned, when we do this in a way that is fun for the community dancing together, you can see even there's a law enforcement person that's dancing along with us, people of all ages, then we have come together as a group. And a lot of the people in this group have gone on to be health ambassadors. So thank you very much for the opportunity to share, and I will turn it back over to you, Dahlia.
Thank you so much, Wanda. And so that was a fantastic slide to leave us out on. Yeah, real community spirit. Thank you for your leadership in Durham and in North Carolina and as part of this campaign. So we've heard from two of our community partners, but this campaign would not have been possible without partnership with local government, because governments are the source of naloxone, systems planners, trying to really understand what's going on with overdose across their jurisdictions. And so we partnered with city governments in most of the cities where we worked. And I'm so pleased to have joining us Kaylee McLeod, who is the director of the Overdose Response Unit for the City of Philadelphia, to share some of their perspective and experience, or her perspective, your perspective and experience with all of us. Go ahead, Kaylee.
Thanks so much, Dahlia. And also, just shout out to the programs that I just heard. Specialized naloxone program. Well, we love that for every population. I love that there are people that are going to go out on the dance floor and do the hustle or maybe the wobble and celebrate naloxone. That's amazing. And I also want to talk a little bit about those folks that may be less comfortable doing that, right? Because when I think about all of this work, what I really, really think about is layering, right? That we want to have protection for everybody. So we want to have protection for people that are out and loud with their recovery, like I am. We also want to have protection for people that don't want to publicly disclose that they're a person who uses drugs or that they love somebody who uses drugs. For so long in the Black community, admitting that you were a person that uses drugs, or that you loved somebody who uses drugs, or that you were friends with people or even associated with people that use drugs, meant that you were going to be overpenalized, right? You were going to have a target on your back, you were going to be overpenalized, and you were going to be overly surveilled. And one of the effects that the war on drugs had that's really long lasting is that many times Black and brown people may not feel comfortable identifying as such. And that is why it's so important that in addition to the people that are going to do the hustle on the dance floor in celebration of naloxone, we also have spaces where people can access these life-saving materials without having to identify as a person who uses drugs. So we are incredibly grateful for Vital Strategies for bringing this in here, and also to Minneapolis that helped us borrow this idea. But in the city of Philadelphia, starting on August 28th, 2025, we were able to put 48,000 312 doses of naloxone in 61 fire stations throughout the city of Philadelphia. We chose fire stations very strategically because we know that the fire department, that firemen and women, EMTs are seen across different communities as very safe, right? So we wanted everybody to feel safe accessing these resources. We made sure that every single box, these are sort of the old school newspaper boxes where you just open them, that they were outside of the fire station so that you did not have to interact with anybody when you were accessing these resources, both on the sides of the fire boxes and on the boxes of naloxone. Are QR codes where you can learn how to use it incredibly quickly. And so we're very proud of that. We wanted to make sure that you could go up to the naloxone box, you could take what you need, and you could leave, right? So you're not going to feel surveilled. You can talk to somebody if you want to. Nobody's tracking you. Nobody's tracking what you're doing, who you are, or what you're taking. But on the other side, having this information across 61 different fire stations in the city of Philadelphia has been a real gift because it helps us to better understand what neighborhoods and which locations are burning through the naloxone faster. And when we overlay that with the fatal overdose rate in those areas, what we're really hoping, fingers crossed, is that we can see which areas specifically and which neighborhoods are saturated with naloxone. And we're really hoping that that will have a long-term effect on the fatal overdose rate. Additionally, one of the things that was really exciting about this is, we got to partner with our partners at the fire department. I think many times, I sort of live in a world that is around substance use and substance misuse, addiction and recovery. So this is a world I'm very familiar with. But I think that all of us feel like this is an everybody situation. So it was a gift to be able to work with the fire department, to bring in the fire department, and to be able to have them become trusted community messengers. We were also able to work with the state of Pennsylvania and their overdose prevention program, which is providing us with the actual naloxone, in addition to the incredible support that Vital Strategies has provided us. So we are so excited about this initiative. It was pretty easy to implement, so we would love to help any other jurisdiction do this. And as always, the goal is going to be to get as much naloxone out to every community member that needs it, whether they're willing to do the hustle or not.
Thank you, Kaylee. And thank you for that plug at the end. Thanks for all your leadership in Philadelphia and for, being ready to share your experience with others. To note, as Kaylee is saying, we designed this campaign to be easy to adapt and use for any city across the country. So we have all the resources on the website. The website is youcansavelives.org. We'll drop that in the chat for everyone in the audience as well. You can go on there and grab resources. You can also reach out to us and we can share more adaptable resources for you. And we encourage all jurisdictions to take advantage of this, whether you're in a local government in your jurisdiction, whether you're in state government, or whether you're in a community organization and a community leader who'd like to carry this forward in your community. We welcome all, and we're so pleased to share it with you. That was the intention for this, behind this campaign. The other point I'd like to make is just that we are able to add additional cities to the campaign website. If you go on that website, you can see that we've already been so pleased to welcome Charlotte, North Carolina, and Las Vegas, Nevada onto the campaign. Since the campaign launched back in March, Charlotte joined Mecklenburg County, and where Charlotte is located, joined not even before the campaign had ended at the end of June. And since then, we also heard from the Southern Nevada Health District, where Las Vegas is located, asking us to please add Las Vegas. So we've been so pleased by those developments and would welcome additional cities to join this. This website will live on. And joining that website just means there's a coordinated central place where you can go on and find, and anybody who wants to see can go on and find naloxone locally in their region. If you add your jurisdiction becomes a place where people see the campaign and they can go on there and find naloxone locally. So please consider or share it with your friends, colleagues, neighbors. We'd welcome more. And with that, I would like to open it up for questions. We have one question so far in the Q&A, but would welcome more. So please, while we're taking this question, I will just encourage you if there are other questions you'd like to pose to our fantastic panel here. The first question is, have there been any multi-sector collaborations, or has there been any in the targeted cities? And can we share some success stories? So Kaylee shared a fantastic success story already from our work in Philadelphia. I think, and you know, I think we could go on with that story. There's plenty more to share, but I think I would say we have additional stories of the work that's happened on the ground. I don't know if anybody on the panel would like to name other places and work, or I'm happy to riff off of that because I can think of a few myself. Does anyone want to share? In Milwaukee, Durham, multi-sector collaborations? Go ahead, Wanda.
Yeah, I will say that our health ambassadors are actually a part of multi-sector groups, and not only age related, but organization and position related. So health, faith, law enforcement, community members, parents, schools, people who are involved in health. And so that is multi-sector, and working together in terms of the campaign and providing naloxone in their areas of influence. And so I think that's what the question had to do with, and that's what we've been doing.
Wonderful, thank you. And I'll name a couple of other places where we worked and where we saw great collaboration. Albuquerque, New Mexico, for example, working with our community partners there, Women in Leadership, and City of Albuquerque, Bernalillo County. Both the county actually adapted, actually took the ads themselves and placed them in additional space, bus shelter space that they had available in the county. And then Women in Leadership adapted the campaign to feature local community leaders from New Mexico and placed billboards actually across the state, featuring local community leaders from the Black community in New Mexico. So that was a fantastic collaboration and partnership that, you know, actually was quite unexpected, and another really success story of this effort. I think I could go on, but I'm seeing additional questions coming. 7 cities, we have lots of stories. Okay, there was a research question. Will you have any future data on whether people picking up naloxone supplies from free or paid sites has increased post-campaign? Fantastic question. Yes, we are gathering, and so this is another important part of this campaign. We're gathering naloxone distribution data from the 7 cities. In some cases, it's the state that actually has that data for the city because the state is managing widespread distribution in the state. But we're gathering that data from all 7 cities where we launched and placed the campaign over these 3 months. We're looking as far back as possible, ideally a year prior to the campaign launch, so beginning April 2024, and at least through the end of this month, September 2025. So we have a real look back period and then post-campaign period. The campaign ended at the end of June. So an additional whole quarter, July, August, September worth of naloxone data as well. Our goal is to be able to look at trends in naloxone distribution, naloxone uptake over that entire period and see what happened and whether and how impact from the campaign may have shaped that. So that will be part of the final research report for this entire campaign. I hope that answered the question. Again, I will name one thing. I'm sure if folks in the audience are aware, but that naloxone distribution happens across many partners and in all kinds of ways in our communities. Because as this questioner I think noted, you can purchase naloxone as well over the counter now. We won't be able to track that data, although you're giving me thoughts. Maybe we could find a way to learn a little bit, but it's more difficult to, of course, track data on over-the-counter purchases of naloxone. But what we will be able to track is the free uptake of free naloxone as it was distributed. Okay, I think I have another question, and I'm having scrolling issues. Okay, we have another question here. Are these, oh, Tracy, were you going to say something? I see you're off mute.
Yeah, I just wanted to bring up, I don't think it's the elephant in the room. It's simply the environment that we're in now as I don't know, last time I looked at the news, we might be on the verge of a government shutdown. But it's important that people understand that naloxone as a tool, as one of many very important tools in the toolbox of overdose prevention. And so there's been a lot of trepidation and fear in different jurisdictions, particularly for those of us who are in, well, I could say harm reduction because it's in my name, but for those of us who are doing harm reduction and risk reduction work and health of, community health that involves engaging people who use drugs, it's very confusing and kind of scary time. And I think that this campaign really has the chance to, I want to say, be a tool or be a resource in the creativity that I'm seeing people um, utilize to adapt to the landscape, right? And so, this is obviously bipartisan. This is in many ways everybody is understands how important a tool naloxone is. But we have to acknowledge the embedded racial inequities that have created a disproportionate impact. The only other community that's seeing the rates of overdose death, like in Black communities, is among Native folks, tribal folks. And so, again, there's history there that you have to keep in mind and have as a context for why it's hard to get uh, the tools, the health promotion tools, into the hands of people who can best utilize them. And I just, again, kind of there has always been a way to get life-saving information to people who need it. And, peers and people with lived experience are beyond some of the most effective ambassadors of this kind of approach and of being able to identify places where people want to know more, want to learn more, want to embrace it. So we're in a hard time, but it's also not the first time we've been in a hard time. And I am confident that this is going to be part of us prevailing.
Thank you, Tracy. Actually, that's the note of inspiration. That is the perfect place for us to close out. So thank you for naming all of that exactly. So with that, we're coming to the end, but I want to just shout out a few folks who you may not have heard from or seen on this webinar today, but who were key partners through this whole process. First of all, I would be remiss if I did not shout out Tony Newman, who is our fantastic press relations lead at Vital Strategies. I would also like to shout out Zebra Strategies, who were our market research firm for this campaign, who really helped us do the work that Sharda shared. I would shout out Ghost Note Agency, who were our fantastic creative partners who put together this campaign and all of the work working back and forth with us. And there were many moving parts of this campaign, so great work. And finally, Mike Frisbee, who is our PR consultant, who helped us work very intentionally with Black media in the 7 cities across this campaign, really important, and to reach the Black media landscape nationally. So he's fantastic working with all of these folks. And then one more, of course, none of this would have been possible without a grant from Elton John AIDS Foundation. So many, many thanks to Elton John AIDS Foundation for recognizing and engaging and supporting this work. Thank you all for joining us today. I hope we'll be hearing from you with interest in sharing this campaign locally, and please don't hesitate to be in touch. Thank you, and wishing you all the best. Thank you, panelists.